If the term norovirus doesn't make your stomach sink, I would argue you might not be thinking of the right norovirus. So norovirus is the virus that's responsible for the vast majority of stomach illnesses, stomach flu. It's that feared thing that's constantly tearing through schools. We see outbreaks on cruise ships. Why are we talking about norovirus now? And the reason is that this is typically a disease that we see spike during the cold weather months. In fact, back in 1929, this was called winter vomiting disease. We've heard about norovirus recently in the news because there's been reports that in the Northeast US, there's this dramatic outbreak, this spike in cases. So I dug into it, and yes, we're seeing more cases, but we're actually seeing kind of the common spike we'd see during cold weather months. And the way we determine how bad the stomach flu is looking at the test positivity rate. So people are sick and they send off stool tests. Recently, the positivity rate, the number of tests that come back positive for norovirus, have been about 14% in the US. Specifically in the Northeast, and they've been above 10% since December. That sounds alarming, but if we go back to previous years, 2023, for example, the test positivity rate in the US was over 15% for most of the winter season. So yes, we're seeing an increase of cases of norovirus, but this is kind of what we see during the winter months. So what do we need to know clinically and also personally to try to stay out of the way of norovirus? Well, the unfortunate answer is this thing is hard to avoid. And we see that because of outbreaks. You hear the cruise ships where hundreds of people are sick with norovirus. That's because this thing is super infectious. And I want to get this stat right. It takes 18 viral particles to spread norovirus, which means the average bowel movement contains 5 billion potential infectious doses. So this thing is an absolute monster in terms of its ability to spread. In terms of prevention, this is the big takeaway when I dug into the literature. Hand sanitizer probably doesn't work. Soap and water seems to be the most reliable way to limit our exposure to norovirus. Wash your hands, sing happy birthday once, twice, shoot, if it's an outbreak, 3 times, get the hands clean. And we don't know exactly how much more effective soap and water are compared to hand sanitizer. There are a couple of studies that suggest that hand sanitizer is 10 times less effective, almost to the point of being completely ineffective. So if you're seeing stomach flu around you, soap and water are your friends. Clinically, this is the stomach bug. You're gonna see vomiting, you're gonna see diarrhea, you're not gonna see a lot of fever, and all of this should be non-bloody. So if you're seeing those symptoms around you or at work in the emergency department, that's likely to be norovirus. One of the questions I had is, do we need to test? In fact, this is how we track outbreaks, is the test positivity rate. And the real answer is that we probably don't need to test most patients who are otherwise healthy. In fact, they've studied in the primary care setting, the vast majority of primary care clinicians don't routinely test patients who have nausea, vomiting, upset stomach, who could potentially have norovirus. So for me, the big takeaways are, every winter, we're gonna see spikes in norovirus. If things are spiking around us, I wouldn't rush off to test folks. I would double down on soap and water. I don't think hand sanitizer gets us there. Be safe, avoid the stomach flu.
This is Hippo Education.